Hello, my name is Dr. Lisa Palmer. I'm a licensed marriage and family therapist working in San Diego. I've been doing therapy for almost 15 years now, and I work with a variety of clinical populations here in San Diego.
Lisa, talk about your style of therapy. Is it tough love, reverse psychology, role playing?
My type of therapy is called emotionally focused family therapy, and it is a model created by Sue Johnson. Basically, the style of the model is to get behind people's reactivity and get more close into what they're feeling emotionally and help people to communicate better versus fight, get hostile and aggressive with one another.
How tough can you be, especially if it means helping a client? Please give examples, and can you elaborate on some of those examples?
I can be pretty tough. I certainly have no issue getting in the midst of big chaos, lots of anger and hostility. If I need to, I'll set boundaries. I'll send people out of the room. I'm especially tough on people who refuse to take a look at themselves. So I have no problem dealing with those types of people.
What do you think of the issue of the overbearing in laws? How would you help a family going through this?
Overbearing in-laws is definitely a big issue in family therapy, and they can be very, very annoying, very, very difficult to work with, and cause a huge amount of conflict between couples in their relationship, especially mother-in-laws that are really obsessed with their sons. So I deal with it by telling them we need to work on this dynamic that's creating so much distress and disconnect between the family, and just call them on whatever they're bringing into the room.
Do you love your job? What's the best part and why?
I love my job. It can be very stressful, especially dealing with people that are in high distress and conflict. I love it though because I get to get in there and help people change the path of their lives and their relationships rather than have them wind up in huge disconnect and drugs, addiction, divorce.
Explain one exercise you use in your practice, a visual example, and why it's effective.
So one of the things we often do when we're working with families, we have them get up and actually stand and face one another and talk about what's really going on, stuff they don't typically say out loud. Sometimes we'll have them actually write it down because they're too uncomfortable or too afraid to bring it up because they know it's going to cause too much conflict. So we have them stand and face each other, and if they can't actually get the words out, we will stand behind them and help them verbalize whatever it is that's causing some torment for them.
What's the most frustrating part of trying to help people in the way that you do?
The most frustrating and annoying part of what I do is when people are unwilling to take a look at themselves. They're in complete denial of how their behavior impacts other people, and it is so annoying to deal with in the therapy room that you really have to even process your own reaction to that person and ask them and kind of call them out and say, what's getting in the way of you being able to hear what your daughter's saying to you, that this is hurtful or harmful to her and her marriage. So you really have to kind of deal with your own frustration and be willing to lean into their chaos to help them with it.
Speaking of the in-laws and how prevalent it can be in today's society, how do you deal with your own in-laws?
With my own in-laws, personally, I deal with my own in-laws by telling them how I'm feeling, making sure that I'm being protective of my family, but also being extremely inclusive and never getting hostile and aggressive unless once in a while I have to do that to be able to set a boundary with my mother-in-law, for example, because I never get to cook. She cooks everything.
How would you go about dealing with a tyrannical in-law? For example, if a mother-in-law was obsessed with her son, like you've mentioned, and treated his new wife like garbage.
Well, I think the first thing we have to identify is what this tyrannical mother-in-law is doing that's creating so much harm and discomfort in the family, and then really bring that to the surface and help the family talk about what's become so harmful in this dynamic. So really helping this mother-in-law to take a look at how her behavior is contributing to conflict in her son's marriage, and hopefully making her feel safe enough and secure to talk about what she's experiencing instead of acting it out and being hostile or treating her daughter-in-law like garbage.
You have stellar credentials, but what sets you apart from the rest?
I think what sets me apart from the rest of the group from a psychological community is that I have experience doing TV, I have experience doing therapy on TV, and I know the difference between good TV and good therapy, and I'm able to ethically provide both and still maintain the integrity of what I do for a living. So I understand that, and I don't think that comes as a common quality in most therapists with TV experience.
And why are you the best person for the job?
I think I'm the best person for the job because I've kind of grown into this part of my career. I've gone behind the scenes. I've done therapy behind the scenes. I've also been on camera in other shows. And I have the personality to handle these types of cases. And I understand what you need in terms of a therapist providing therapy to these families to make it TV and show worthy.
In this program, you will work with a variety of different personalities. Sell us on your versatility. Describe some examples of times that you have accommodated people in a variety of difficult or challenging situations.
Well, across the 15 years that I've worked in this field, I've worked from, as difficult with guys that are locked up and criminals and are locked up for life because of murder or continued assault and rape, all the way to working with families dealing with situations that have to do with in-law relationships. I think one of the most difficult things that I've worked with in the past has been a guy that was struggling with his urge to masturbate, and he was what we would call a chronic sex addict, and he would often come into the office and have to excuse himself so that he could handle his business. And so we had a really hard time setting boundaries with him, but after a while we were able to help him kind of soothe in a different way so he could stay present and participate in therapy. But I've worked with a wide range of clinical symptomology.
Do you think a reality show about the in-law problem could help people all over the country, all over the world?
I think it would be helpful for other people to see how difficult it can be with families, especially integrating in an in-law situation that maybe isn't a great fit with one another. I know that there's always going to be a connection between the parent and their child, but oftentimes the connection between that parent and their spouse is not that great. I think there's a lot of shame around that when people are dealing with that, and it would be nice for other people in the world to see that this is a normal dynamic and it can get really hostile and aggressive, but if you hang in there, you can work through it and things can be different. The goal is to stay connected and not disconnected.
Thank you. That's the end of our questions, but is there anything you'd like to say to the viewers that are watching this tape?
I guess I'd like to say that I'm very interested in hosting this show and being a part of the therapy and the process, and if you have any questions or you'd like to speak with me further, I'm happy to take your phone call.